Hi, everyone, and welcome to the Collaboratives webinar on Missed Opportunity, addressing harmful alcohol use to prevent violence in the family. We have started this session, and please feel comfortable to use the chat box to introduce yourself, your organization, and where you are joining us from today. You can also view the speakers gallery and you can see the slides, or you can view the gallery with the audience where you can see everyone that has joined today. But we enjoin you to always be on speaker's view so that you can see the slides as the speakers share their screen. We would also enjoin you to use the chat to ask your questions or to share your comments, or you can also use the Q&A function. You would see that beside the share button, or you can see that in the more button. So if you click on more on your Zoom, you would see the Q&A option to share your questions as the webinar go along. Please feel free again to share your name, where you're joining us from, and your organization. Over to you, Rita.
Thanks so much, Toby, for taking us through the meeting etiquette. If any problem, like Toby said, flag it, and then we'll support you join fully this webinar. So I'll quickly introduce our speakers today. So we are really privileged to have a group of really experienced speakers. We have Dr. Ingrid Wilson. Ingrid is an assistant professor at the Singapore Institute. And if you can see, yeah, great. Ingrid is an assistant professor at the Singapore Institute of Technology and honorary research fellow at the Judith Lumley Center, Levtov University. Her research explores opportunities to reduce alcohol-related intimate partner violence, drawing on the experience of women survivors. She has worked as an advisor on alcohol policy for the Victorian state government and public health advocacy on alcohol for Australian Drug Foundation. So we really appreciate the time you made to be with us today, Dr. Ingrid. Thank you so much. We also have Ruti Levtov. Ruti is evidence and influence lead at the Prevention Collaborative, and she's a gender and public health specialist with more than a decade of research, programmatic experience in gender equity and violence prevention. She has worked across multiple sectors, including health, education, parenting, and economic empowerment, with a particular focus on developing and evaluating gender transformative and male engagement interventions in low and middle income countries. Thank you so much, Ruti, for being with us today. We also have Adila Maker-Dedrick. Adila is public health advocate with experience in developing and producing edutainment and multimedia interventions, trainings, social mobilization, and campaign management. She has worked in the civil society sector for over 25 years in the area of sexual and reproductive health, HIV and AIDS, gender and alcohol. She managed the award-winning Soul Buddies program in South City, Puza. I hope I pronounced it well. Soul Buddies program in South City, Puza, WISE campaign. I guess it's in South Africa. And currently she's coordinating the Southern African Alcohol Policy Alliance, SAPA. Thanks so much, Adila, for making time to engage with our webinar audience today. Last but not at all least, we have Dr. Leanne Ramsomer. Leanne is a public health researcher and research uptake specialist at the South African Medical Research Council. She is an experienced behavioral scientist with 22 years experience in conducting quantitative research, impact evaluation, policy analyst, and desktop review in the area of alcohol and other drug use, violence against women and girls and their intersections, HIV and AIDS, and academia. What an experience. So I wanted really to take this time to emphasize on how privileged we are today to have Dr. Ingrid, Dr. Leanne, to have Adila, who brings such an extensive experience working on this topic as both researchers, activists, and practitioners. This is such a great pleasure having you with us. Thank you so much. And I would like to recognize that in the room today, we may have many of you with experience on this topic. And as our speaker take us through what they prepared for us, I would encourage you to really feel free to interact in the chat, and remember, please, to put your questions in the Q&A box or in the chat so this can be addressed later. Okay, so without any further ado, I will hand over to you, Dr. Ingrid, to take us through what you prepared for us.
Thank you very much, Rita.
Slides.
Thank you. And it's an absolute honor to be here today to address you all. Firstly, I just wanted to note a content warning. I will be presenting quotes directly from survivor voices. And so I do note that there may be survivors in the room. So do take care of yourself, but also do reach out to the team if you do need any support. But I also want to pay homage to the resilience and strength of those who have lived experience of alcohol-related intimate partner violence. So the next slide, please. So there is absolutely clear evidence across many countries of the role of alcohol in increasing the risk and severity of intimate partner violence, and that evidence comes from mostly quantitative research. But one of the things I think that is kind of lacking in this space is the perspectives of female victims and survivors. And so my research has really been about elevating the voices of those with lived experience. So what I'll be talking about, if you could click, please. Thanks. So I'll be giving an overview of the qualitative research, drawing from my own PhD research, but also from a more recent global qualitative review, which is really putting forward the voices of women and extending our understanding of the impact of men's drinking and violence on women's lives. Next slide, please. So my research, which was some time ago, but in fact it's really interesting that these debates and issues are really surfacing again today. So one of the things that I did was a grounded theory study, and I really wanted to reach a community audience. Much of what we know about alcohol-related intimate partner violence tends to draw from say partners whose husbands or spouses have more serious alcohol problems, or from women who are in shelter settings. But we don't really know about the experience of those who really aren't engaged with formal services. So my research, I undertook in-depth interviews with women who responded to my recruitment notice on the basis that they did indicate they felt afraid when their partner was drinking. And these women ranged in some were quite young, some were in their 50s. And in fact, I had women in their 70s reach out to me, even though I was not able to interview them based on the my ethics range. Next slide, please. And if you could just click ahead and we can see the animations there, that would be great. So really, when I pieced together what women were telling me, was that this experience of living with a partner and experiencing violence that was alcohol fueled, it was experienced in the form of a cycle. And women talked about this, an initial start of the drinking cycle, where sometimes the partner was quite happy and fun, but then it increasingly became more dangerous. And you'll see there that where we talk about women being unsafe and stages that were safe, or the worst stages, these were women's own words in the way that they were describing this experience. And I think that quote there really highlights this progression. So as Kath said, once he started drinking on a Friday night, then this Mr. Happy, Mr. Bouncy would come out. But then Mr. Happy started turning into Mr. Sarcastic, making personal remarks, and then being threatening, and then, hurting. And if you could click, please. So one of the core things that did come out of this experience was that every time their partner picked up a bottle, went to the fridge, that signaled for these women that they could anticipate an episode of abuse. And they may not have experienced this every time. It may not get elevated to the worst aggression that's indicated there. However, it happened enough that women recognised these patterns and had to prepare every time. If you could just click to the next slide. Thank you. And I'll get you to click ahead with all the animations. Sorry about this, just so that it's not too distracting. Okay. So really what I also did when women were talking to me about their experience and what this was like, I mapped to these stages the safety strategies that women put in place at various points of this cycle. And so you can see there that these were classed as preventing. So women did all that they could to try to stop him from drinking, which was, pouring out alcohol, minimizing the triggers, planning ahead events so that, they weren't going to be access to alcohol. But then when the drinking was occurring, they were in vigilance mode. So very much they had to, keep an eye out for the signs. And then they talked about seeing it coming. They talked about, when he was reaching that kind of, provoking, looking for a fight stage, they could see it coming. And that's where women talked about responding, and they talked in different ways. Some would fight back against unjust accusations. Others would, put their head down in a very tactical, passive way. So you can see from that quote there that Linda's saying, when he's drunk, I just try not to argue with him because I knew it would never end well. And then you can see how in the worst stage, women were protecting, they were going into lockdown, taking their children away. But then they would return when their partner was incapacitated, because that was the safe stage. However, women talked also about having to kind of look after their partner to make sure he was safe at that stage, despite having been placed in such a dangerous position beforehand. So you can see this kind of, tension that women are placed in, having to be, protecting themselves and their children at the same time as having to be a caregiver for their partner in his drinking. And then just to kind of click again, you can see that at the end, there's the having to kind of reintegrate and pretend things are normal again after this cycle's over, and in the face of often denial from the partner, or plainly he does have no memory. Okay, so you can see how this can really mess with women's heads. So I'll just click again then to the next slide. So that's about the episode. So my research also kind of highlighted what it's like over the course of the relationship and how women navigate living with a partner with alcohol-related violence that they experience. So the next slide. And just if you could click ahead there, and I'll go through this very quickly. But just in the early relationship, women don't see the drinking problems, mainly because it's very much masked by a culture that really celebrates men's drinking. So anything that's problematic is really very hard to detect in that early relationship. But then it's when relationships become more established, women, they have children, that's when they start to notice that the problematic drinking and that cycle that I just described starts to become a recognised pattern. This is where we also see the role of alcohol really having a big impact on the household functioning, and is also a source of conflict within the marital relationship. Women do all they can to try to fix his drinking, but often where the partner's not keen to seek support or treatment, they have to then manage their life around the abuse. And if you could just click ahead a few times for the last few quotes, then you can see that women, when they run out of hope, mainly around not even necessarily around the violence, but they run out of hope about him stopping drinking, because for them that's where their most kind of heightened fear comes from, and the impact. And you can see also, even when leaving the relationship, this experience really continues on into their new relationships, as well as having to reset normality around being around alcohol, which can be very difficult in cultures where alcohol is so pervasive. So women often limit their access to public spaces, mainly because they're so triggered by being around alcohol. And just the next slide, if you could, thanks. And I'll just very quickly move through this, so I'll get you to click ahead, please. So that was my research, but we conducted a global qualitative review with Dr. Leanne there as well, where we wanted to see, was this experience similar across other countries? And so we did map in this image here, and we can post the link to the actual paper. There's a whole range in which ways that women's lives are impacted by men's drinking and violence. So not just the violence, but through the economic impact, as well as things like the social harm and the impact on relationship and family. And I'll just click on to the next slide, which has a few quotes just to illustrate some of the impact. So yes, if you could just click ahead one more. So you can see one of the things that we actually we really don't know a lot about is the fact that how his drinking contributes to heightened sexual aggression. And that's what came out in our review. And this can also lead to unwanted pregnancies, as well as STDs, etc. A big thing too is where men's drinking disempowers women economically, where the diversion of household spending to his drinking away from household necessities. And also because often where a man's alcohol problems might affect his ability to work, women carry that burden of income generation as well as taking responsibility for household functioning and the caregiving for children. But importantly, what we also don't hear about is the impact on women's their kind of social lives, the isolation and stigma that women already experience when they're surviving violence, but they're also doubly stigmatized by having a partner with alcohol problems. So just my last slide then, in summing up. So what women are telling us, and again, my research is all about putting forward the voices of women, is that men's problematic drinking really does have an insidious impact on their lives. And for some, the alcohol and violence is so entwined that, as the cycle highlighted, they only need to pick up a bottle, and that puts women into this state of fear and needing for protection. We do see there's a whole range of ways that women are impacted. And what sits around this is a culture that entitles men to drink and makes it very difficult for women to question. And just the last click, thanks. So really what we need to do so what we really need to do is we need to engage with this complexity, and services need to understand and engage with what women are telling them. So we can't gaslight them by telling them alcohol doesn't have an impact, because that's what they're telling us. And we need to support interventions to address men's problematic drinking so that we can actually stop that pattern and that cycle of drinking and violence. So thank you, everyone.
Thank you so much, Ingrid, for sharing your research and also for highlighting how all this impacts women's lives. I will hand over to the next speaker because I want to maximize time and let people get enough information so we can have a rich discussion at the end. So Ruti, if you are ready, please go ahead and take us through what you prepared for us. Over to you, Ruti.
Great. Thank you so much. And thank you, Ingrid. We wanted to start with sort of foregrounding women's voices on this topic. What I'm going to present about is a review that we recently completed, an evidence review around addressing harmful alcohol use to reduce violence in the family. And we are focused in this review on intimate partner violence and violence against children in the family. But I want to acknowledge that alcohol is associated with a variety of other forms of violence as well, and that we need interventions and actions to address a lot of that as well, including working with young people on these topics. So in my presentation, I'm going to basically provide an overview of the review. I'll talk about associations between alcohol and violence. I will explain a little bit of pathways between how alcohol leads to violence and our understanding of that. We'll talk about what works to reduce harmful alcohol use, and then we'll talk about addressing alcohol in violence prevention programming and some of the implications there. So next slide, please. First of all, alcohol and IPV perpetration. Dr. Wilson mentioned this already, but men's alcohol use has been consistently shown to be related to intimate partner violence. Heavy drinking in particular, so what is often called binge drinking or having multiple drinks at a time, is more strongly associated with IPV, and also alcohol use increases both the frequency and the severity of violence. And this is a relationship that we really see quite globally. So a recent study that looked across 28 countries found that women were 2.5 times more likely to experience IPV if their partner drank alcohol. Next slide. The relationship among women, the alcohol appears to be both a consequence and a potential risk factor for experiencing violence. Women who experience IPV may be using alcohol as a coping mechanism or to numb themselves in anticipation or in response to current violence. And alcohol use can also be a risk factor for experiencing violence, but the evidence on that is somewhat conflicting and limited by some methodological challenges. I do want to mention that we need to be very careful about talking about women's alcohol use and sort of blaming women for any violence that they experience. So we need to understand the risks, but we need to be careful about how we are framing and talking about them. Next slide, please. Violence and alcohol against children, alcohol and violence against children. So harmful use of alcohol by parents and caregivers can have a range of detrimental outcomes for children, including violence against children. Harmful alcohol use is linked to poor parenting practices, and particularly in settings where parents have limited support, parents or caregivers might be using alcohol to cope with stress and frustration from parenting. At the same time, parenting or relationships with children can provide the motivation to stop or to reduce drinking. It's also really important to acknowledge that the relationship between alcohol use, intimate partner violence, and violence against children in the home is really complex and difficult to disentangle, and is something that can sort of continue across generations. Next slide, please, and you can read a bit more about that in the review. Before we move on, I wanted to flag, given this, sort of, I would say now decades of research showing the relationship between alcohol and violence, why there isn't, it seems maybe surprising why there hasn't been more work across these sectors, why there haven't been more joint efforts. While this does vary across contexts, there's it comes from a different historical and philosophical perspectives in these fields. And some of it comes from a concern that focusing on alcohol might take away from the many years of activism and the feminist perspectives that violence is, or sort of undermine feminist action, that gender inequality and patriarchal power is really what is driving violence. And so there's a concern that focusing on alcohol might allow perpetrators to evade accountability, to evade responsibility. And while the alcohol field has very much focused on structural level policy solutions, at the individual level, there are attempts to destigmatize alcohol use, to encourage people to get support. I think what it means for us is that there's a lot of opportunity to try to come together to work on these topics and not say it's this or that, but that it's both, and that these are important things to be working on. Next slide, please. And I know there's many of you who have much more to say on this as well, so please feel free to add in the chat and in the Q&A. Before we move on, I also wanted to mention the role of the alcohol industry, which is a multi-billion-dollar industry. It's dominated by a handful of multinational companies that that have expanded across the world and increasingly focusing on low and middle income countries. A lot of the policies, which we'll talk about later on, that address alcohol use are ones that sort of hurt the bottom line of the alcohol industry. And so the industry is highly organized and strategic and active in both marketing their products as well as obstructing regulation and enforcement of it. I think another thing that's important to think about is that it frames, the industry sort of has an interest in framing alcohol use as an individual responsibility, which focuses interventions and attention away from the structural and policy level interventions that are needed to address this issue. Next slide, please. So I want to talk a little bit about the pathways that sort of lead from alcohol to violence, and in this case, specifically intimate partner violence. So in this, what you see on the screen here are some of the risk factors for harmful alcohol use. And you'll note that some of these are also risk factors for the use of violence. At the structural level, we see things like the availability and affordability of alcohol, enforcement of laws and policies, availability of services, as we mentioned earlier, the influence of the alcohol industry, poverty, and other factors. We also, things that are linked to harmful alcohol use are norms, norms related to masculinities, that link masculinities to sort of excessive drinking, norms around women's drinking, and just peer cultures like drinking at sports events or in university settings, things like that. So peer cultures. There's also some individual characteristics, age, personality traits, a history of kind of adverse childhood events, experiences, and parental substance use, and of course, stress and mental health. So these are factors that are risk factors for harmful alcohol use. Next, please. Then some of the pathways that might lead, pathways between alcohol use and violence, we have a set of physiological pathways. So when people are drinking, it can affect their cognitive abilities, their ability to problem solve. It lowers inhibition. It can focus attention on specific things and less, so specific triggers or things like that, and less focus on consequences, and it reduces self-regulation. There's another pathway, and these are linked, that also we heard a little bit about in Ingrid's presentation, these family dynamics and relationship pathways that are affected by drinking. So drinking can erode the quality of the relationship and trust in the relationship. It can contribute to financial stress, and conflict around that. And it can be linked to sort of gendered expectations and power dynamics about what men and women might do in a relationship. Next, please. Now, it's in this panel, we have factors that change the likelihood of violence given drinking. So we've all heard, not everyone who is drinking is violent, and not all drinking leads to violence. But we do want to highlight some factors that sort of instigate or inhibit when a situation might turn violent. So some of these are contextual factors like norms and scripts around, what is sort of acceptable behavior while drinking. There's norms around gender, around violence and help seeking. And again, this context of alcohol use. There's situational triggers in the moment. So if there's a specific conflict trigger, or if both partners are drinking, that sometimes is more likely to result in violence. And then, of course, individual factors like self-regulation, empathy, and some personality traits as well. So in the review, we sort of lay out this pathway, but one of the really important things we want to highlight here, and next, please, are that there's really multiple opportunities to intervene. So there's opportunities to intervene to reduce the use of alcohol, and we'll talk about that in the coming slides. But there's also an opportunity to intervene to reduce the risk that alcohol results in violence. And it's important to, as much as we can, do both of those things. Next slide, please. So what works to reduce alcohol use? There's sort of a range of interventions at multiple levels, at the structural level, the community level, as a group, as well as individual interventions, and that all of these are complementary and necessary. And this is actually quite similar to interventions around violence as well. So next slide, please. At the structural and policy level, these are interventions that are really key to reducing alcohol consumption. The WHO has a set of policy recommendations that include restricting availability. So this means restricting the days or hours of sale, reducing the number or concentration of outlets that sell alcohol. You can reduce affordability through a variety of mechanisms, as well as regulating or banning alcohol marketing. And there's a range of other things as well. And it's important to say that the policy impact on drinking and on violence is context specific. We actually have strong evidence of the impact on violence in general, but there's a little bit less on the impact on IPV specifically. And it might be that some of these policies have unintended consequences that shift drinking from sort of outside of the home into the home or exacerbate some tensions. So when we're looking at policies, we really need to be thinking about the dynamics in the home that they are creating as well. However, these are, true and tested interventions. Next slide, please. Community interventions are necessary to sort of support and sustain both individual level change, which we'll talk about in a minute, as well as alcohol control policies. These types of interventions, which we found less of, to be honest, in our review, really aim to change the drinking environment. They aim to change drinking-related social norms, as well as create community awareness and mobilization and support accountability and enforcement. And I'm excited to be hearing more about this from Adila and Leanne momentarily. Next slide, please. Group-based mutual support programs. These are programs similar to, or Alcoholics Anonymous or similar. These are programs that may be particularly promising in low and middle income countries because they're group-based, they are more cost-effective in some ways. And interestingly, the research suggests that AA programs work better or as well as or better than many other programs in abstinence from drinking or reducing the intensity of drinking. AA has both a social component that includes social support and role modeling and mentorship, as well as structured kind of a 12-step program in this case that is intended to help participants initiate and maintain abstinence from drinking, and teaches sort of coping skills and improves well-being. Next slide, please. There's also a range of individual interventions. These are individual sort of psychological and behavioral interventions. They really vary in length and approach, from very short ones that are 5 to 10 minutes or 5 to 15 minutes to kind of longer, more behavioral interventions. There's also some pharmacological treatments. One of the things that was interesting is that many of these seem to be fairly comparable in their outcomes, perhaps because they use their sort of common factors across these approaches. Next slide, please. All right, so, at the Prevention Collaborative, we focus on violence prevention, and really we're trying to understand what does all of this mean for violence prevention programs. So first of all, very few violence prevention programs explicitly address harmful alcohol use in their content. It might be mentioned as a risk factor, but there isn't, there isn't much content beyond that. However, we have found that several programs have, and actually just to say, this is also true that relatively few alcohol reduction approaches specifically address violence prevention. There are some programs, which you can read about in the review, that do intentionally address both. But we have seen within the field of violence prevention, we have seen some IPV programs that have shown impact on both alcohol use and IPV, even with fairly limited content around alcohol. And it may be because these programs are actually employing some of the kind of elements or factors that are contributing to reduction in alcohol use that are used in alcohol programs. So they're aiming to strengthen self-regulation skills. They're building stronger social ties, and by that, sometimes providing alternatives to drinking. They focus on kind of aspirational goals in a more positive sense of your relationship and your family. They also focus on masculinities and gender norms, which you can unpack to understand the link between masculinities and drinking and masculinities and violence. They focus on relationship skills, and they're often also highlighting kind of financial decision-making and bringing in this understanding of how alcohol in the family affects finances. Next slide, please. And sorry, just to say all of this, there are opportunities to further incorporate and strengthen alcohol reduction strategies within violence prevention. That's probably our strongest message going forward. So next slide. To that end, what are some implications for practice? And really thinking here from the perspective of violence prevention groups, but perhaps also relevant for others. I think the first one is just to take this seriously and start taking action on alcohol use. That means strengthening the collaboration and co-learning across these fields, as well as the field of mental health. And that's some of the things that we're working on at the collaborative through these reviews and through forthcoming kind of expert interview document that we'll be sharing. That tries to take lessons from alcohol and mental health into violence prevention. Opportunities to join advocacy efforts for gender-informed alcohol regulation, ensuring that programming addresses gendered and relationship dimensions of alcohol use, so bringing that into the discussions we're already having about these topics. the opportunity to measure both alcohol use and violence within our program evaluations, so we can learn more about this. The importance to select, train, and support practitioners and facilitators to address both of these topics, and to recognize the need for additional specialized support and referral pathways when needed, both for alcohol and for violence, as we often do. Next slide, and this is the last one. I think for, again, violence practitioners, there's an opportunity really to build on the most promising approaches and to seek opportunities for integration and innovation. So intentionally addressing alcohol use, integrating what we know from alcohol interventions into our existing individual and group interventions, thinking about opportunities to connect or establish these kind of mutual support groups like Alcoholics Anonymous, and finally, thinking about community mobilization to involve communities in advocating for alcohol policy regulation and their enforcement. And with that, I will end and turn it back to Rita and then to our next speakers.
Thank you so much, Ruti, for sharing what came out of the review. And we really have to recognize that this is a lot of good information, particularly how you laid out this pathway of where alcohol can lead to violence, both perpetration and experiencing. It's really important for us, many of us here, especially practitioners. And thanks for ending with these implications for practice. I think that will fuel our thinking on how we can be more intentional. So I know we still have Leanne and Adila to speak to us, and I want to encourage colleagues as we go through these presentations, please put your questions, reflections, let's be interactive in the chat, and we'll have time to discuss during the Q&A. So with this, I will hand over to you, Leanne and Adila. I know you shared the presentation, so feel free to go, whoever starts. Over to you.
Good afternoon. So Leanne and I will share this presentation, and just thank you to the Prevention Collaborative for inviting us to share the findings of our feasibility study, where we essentially looked at how can we look at involving communities in mapping alcohol availability, which basically brings together 2 points that Ruti had raised early on. The one is around alcohol availability as a key issue for reducing consumption and subsequent harm, and that of getting communities involved in mobilizing for enforcement and being involved in the issue of monitoring and from our perspective, the issue of applications of liquor licenses in residential areas. Next slide, please. So just a little bit of background. This study was done in South Africa in 2 sites. And so in terms of the South African context, we have a very high rate of alcohol use and is considered as one of the highest, one of the countries with the highest rates of binge drinking in the world. Although only about 31% of our population consumes alcohol, about 59% of them drink heavily. And Ruti had mentioned earlier on the relationship of binge drinking and the kinds of harms that comes from binge drinking. And so the WHO recommendations on looking at alcohol availability as a key strategy for reducing alcohol-related harm is our focus, specifically looking at outlet density and trading times, and looking at how availability of alcohol increases consumption and its related harms. In terms of the WHO recommendation around reducing availability as a key issue for us as an organization and in partnership with the Medical Research Council, that has been the focus of the study. And as I said earlier on, for us, the key issue is how do we get communities to play a central role in lobbying for regulation of alcohol in where they reside. Next slide, please. So this study was premised on the global recommendations that if we want to lower the harmful levels of drinking and its harms, we must look at the availability of alcohol in communities. We need to look at how many outlets there are in communities. We need to look at how easy it is to get alcohol within communities and how communities can use their own local knowledge and skills to reduce alcohol harm, which from our perspective would lead to community action. Next slide, please. So in South Africa, we have different laws that regulate the availability, trading, distribution, and marketing of alcohol. So we've got the current Liquor Act of 2003. We've got the National Norms and Standards of 2015. We've got a national policy that was adopted in 2016. But we are particularly challenged that every single province in South Africa, the 9 provinces, are regulated by different liquor laws. So there's no one common law that is regulating the whole of South Africa. The national law essentially just provides a framework, but each province has got autonomy in how they apply laws within their own province. And then we've got a National Liquor Amendment Bill on the table that has been stalled since 2016. And what these laws does, it looks at how outlets, it basically talks to outlets having to be licensed to an application through comments and in writing, that the trading hours is regulated by either provincial law or local bylaws, that no sales of alcohol should be allowed to persons under the age of 18, and that alcohol should not be traded in within a radius of 100 or 500 meters from schools. And that depends on the provinces. Next slide, please. So I'll hand over to Leanne at this point, and then I'll join you later. Thanks.
Thank you very much, Adila, and good afternoon, everyone. I'm going to pick up from Adila in terms of the study objectives. So, as Adila has already spoken about, we set out quite intentionally to test the feasibility of quite a participatory approach to mapping alcohol outlet density or availability, which includes both density and trading times in 2 communities in South Africa. One of them is in the Gauteng province, also known as Johannesburg, and the other one is in the Western Cape. And we wanted to firstly test the approach, particularly in relation to working with locally identified community members who lived in the areas that we wanted to map in, because we believed that they could bring a wealth of experience into the research endeavor. We also wanted to examine the association between alcohol availability and gender-based violence and other crime. And we really wanted to speak to local community members and representatives of community structures to hear what their views were on alcohol availability and alcohol-related problems in their communities. So you'll see that I've got some various iterations of slides, and the one on your extreme right, which is the black and white one, is very much an aerial map of a particular municipality, and that's where we started off. And then we moved on to also get to an area where we created a contextual map of the areas that we were looking at. And then below you can see that on the extreme right at the bottom that we then ended up with mapping alcohol outlets in those particular zones. Next slide, please. Thanks. So we conducted this study as a mixed method study. And we included different but complementary research methods. One of the research methods included a desktop research to identify known sources of data for licensed outlets in the 2 communities. And we use the National Liquor Authority database in one site, and in another site, the Liquor Authority, the police statistics around alcohol outlets which were licensed. Then we did a desktop review to identify and verify the global positioning, the GPS point data of those alcohol outlets. And we sent the trained field workers into the field with partially completed maps based on our desktop exercise. It was then that the field workers collected information using cell phones through RedCap on the GPS location of the alcohol outlets, the types of alcohol outlets that they were. So, for example, shebeens, which are quite popular in the South African context. They're more informal alcohol outlets, pubs, taverns, etc. We were also interested in understanding the type of alcohol that was sold, very keen to understand opening and closing times, particularly in relation to what Adila was saying about there being multiple laws and bylaws that govern the different provinces. And we wanted to look at the days on which alcohol was sold. In terms of the qualitative work, we also spoke to people from the community and who we identified as sort of key informants in the community that represented NGOs and other community structures. And we interviewed them in individual in-depth interviews. And then we spoke to members of the community themselves that were affected by these alcohol-related issues and alcohol availability. And we did this through focus group discussions. Now, for time limitations, I'm going to stick to some of the highlights of what we found. Okay, so in terms of the two sites, across the 18 zones that we had looked at in the two different sites in two provinces in the country, we found 383 alcohol outlets, 178 in Ga-Rankuwa, which is in Gauteng, and 205 in Thembalethu. And we found worryingly that most of these alcohol outlets were in residential areas. 92 and 97% respectively in these two sites that we looked at. Unsurprisingly, taverns and shebeens were the most common outlet types in both communities, and beer and cider, followed by cider, were the most widely sold types of alcohol. We also found that there were very long trading times and that most of the alcohol outlets opened 7 days a week. And when we actually did apart from the mapping work we did, when we did qualitative work, we also found that alcohol was available for pretty much 7 days a week at any time of the night or day for a large majority of these outlets. Next slide, please. Licensing was something we were particularly concerned about, again, against the backdrop of the fact that South Africa has got a large number of unregulated and unlicensed outlets. And again, we found that only 20% of the surveyed outlets that we had worked on were licensed, 55% were unlicensed, and the remaining 25% were unknown. But for those that were unknown, we can almost safely assume that those two were unlicensed. And this was also true for Thembalethu, where 20% of the surveyed outlets were licensed and 76 were unknown. Next slide, please. In terms of opening days, the majority of the alcohol outlets opened every day of the week. And this was despite any bylaw that they were governed by. So they did not necessarily open from a Monday to a Friday only, or some people open from Monday to Saturday, some people open from Monday to Sunday. And for the majority of the outlets that we had looked at, they had opened every day of the week. In other instances, people open at least 5 to 6 days of the week. Now, it's worth noting that the majority of these outlets, particularly the shebeens and the taverns that I mentioned, operate largely outside of the bylaws. And so they tend to open most of the week and at any time of day that is suited to them and to the community needs. And this often means that unlicensed outlets and outlets that are opening for longer times in the day means that their alcohol is pretty much ubiquitously available to communities that we surveyed in. And this is reflective of many communities in South Africa. Next slide, please. I just thought to show you the maps. So I started off by showing you the very early maps that we had. And each white dot represents a surveyed outlet. And if you look or even in the brief that we've attached to this webinar, you will find that that in Ga-Rankuwa, there are notable variations in alcohol outlet density across the zones. If you look at zone 4, 5, and 14, as well as zones 17, 23, 24, 25, which are in the dark red, you can see that they all have a higher alcohol outlet density per 1,000 people than do other zones. We also found that alcohol outlet density, if you look at the green map, reflects a similar pattern in the number of GBV cases that we identified in those zones. So you can see a clear overlap in the clustering of alcohol outlets and larger alcohol outlet density, and then in this instance, physical and sexual intimate partner violence. So clearly there is some overlap there. When we did a statistical analysis of this, we found there was a positive correlation between the GBV cases that we identified and alcohol outlets in Ga-Rankuwa. We were not able to do this in Thembalethu, which was the other site, because of bureaucratic processes that didn't give us an opportunity to really look at the GBV stats, but we had some crime stats. Next slide, please. So this is exactly the same type of map, but for a different area. And again, you can see that there is a clustering of alcohol outlets, particularly in zone 4 here, and that alcohol outlets are spread across the different zones and often also border different zones. And generally, although you can't see the contextual map here, generally these are very close to schools and very close to religious organizations, and those are usually prohibited by some of the bylaws. So immediately spotting a problem in these communities in that regard. Similarly, on the green map, you can find where we looked only at selected crimes that most closely approximated to gender-based violence stats. You can see that there's an overlap here on the areas in which there's a high clustering of alcohol outlet density and then the selected crimes. Next slide, please. I'm going to hand over to Adila just to take you through some of the qualitative insights and see us through the end of the presentation. Thanks. Back to you, Adila.
Thank you. And so some of the comments that people shared with us in our qualitative interviews and focus group discussions is that on the whole, across both sides, people saw alcohol as a problem in their community. And particularly, they linked alcohol consumption to men consuming alcohol, not to say that it was that women don't consume, but most often people spoke about men, and most often they spoke about alcohol in relation to interpersonal violence. And people would talk about how alcohol leads to many other problems in the community. So, for example, the problem is after they drink, most of them lose control, their mind, and we are always intervening in families. You will find that parents fighting and that, small children, and it's not like that they don't have a happy family because of alcohol. So this was from an NGO worker. And these are direct quotes. We haven't fixed the grammar at all, so please take it for how that was said. And that alcohol often diverts money from basic needs of the family, for example, around food, and that alcohol, purchasing alcohol when people have money often is the first preference before they look at any other need of the family. And that young children and young people are harmed by alcohol use. And for us, this was a particular issue around child neglect and child abuse. Alcohol, the quote reads, alcohol is a problem, especially young ladies with kids. They leave them in the house alone and go drink. The kids end up being burnt, others are raped, others don't know where the child is and is hurt because of the next morning. We are called as by the CPF, and social workers have to then step in to support helping with making sure that children access services. Next slide, please. In both sides, communities felt that they should have a voice in making decisions around alcohol trade and licensing, that they thought that they should be consulted. They thought that they most often know their community, they know the people that live there, and so they would be able to see whether or not whoever applied for a license is actually appropriate. They would know where this person lives, and the kind of behavior around the potential establishment that they are applying for. Of concern was the fact that people felt that there was not really a response by the police when they called them in to deal with issues around alcohol-related harm and problems. And I will read. Alcohol has become a problem in our township in a sense that even the SAPS, this is the South African Police Service, instead of raiding those taverns or shebeens, they really don't do that. And we have a problem on the national roads that you find that on the garage, they sell alcohol, which encourages drivers to drink. And at the same time, you report a case of alcohol abuse at the police station. Nobody is taking care of that. And I think that it's high time that our law enforcement agencies, they need to know what needs to be done and what not, implying that community members perceive in the enforcers of law not to really understand the law or how their role in its application. And then, of course, and I think what has come through this whole webinar is that people spoke about the fact that alcohol is related to the experience of GBV. And in different, throughout the interviews and focus group discussions that emerges. Thanks, Leanne, for clarifying garage and gas stations. Next slide, please. So just in conclusion, despite the fact that the South African government have got several control measures in place and that we've got laws that regulates alcohol availability, alcohol outlets are densely distributed, particularly within residential areas, and many of them operate without licenses and are outside of outside the regulated times. So I think in the previous slides, Leanne highlighted the fact that we would have 20% that are licensed and that the rest are unlicensed, and that is pretty much reflective of the situation across South Africa. We found that it's feasible to involve local communities in data collection and in the decision-making around alcohol availability within their own community. Local authorities can and should increase its efforts to gain community input in the process of awarding liquor licenses, and that reducing alcohol availability through evidence-based control measures can help limit the negative impact of alcohol consumption. Next slide, please. Thank you. In South Africa, different languages. For those South Africans that is online, thank you. Enkosi Kealabucha and bye dankie.
Oh, thank you so much, Adila. Thanks, Leanne, and thanks to all our speakers for sharing. This is such rich information in one session, right? I guess colleagues who are attending today will agree with me that we really we really got information, and I wanted to start us with a question and answer session, but really wanted to acknowledge how rich this research that Leanne and Adila presented, and as they were going through, I really could relate. You know, we can relate to how alcohol is a problem, and if it's not from a deep research, what we hear in our communities, we know that alcohol is a problem and it leads to many other problems. And thank you for establishing the association between alcohol and GBV and IPV. That's really so helpful. So I wanted us to take a few questions, and please, if you have a question that you didn't get an opportunity to put in the chat, let us know in the chat, and we'll give you a few minutes to voice your question. So I'll start with a question to Ruti, and please, our speakers, feel free to jump in and add to what your colleagues shares. For Ruti, beyond pharmaceutical approaches, how can we integrate herbalism or plant-based solution support to communities that may distrust pharmacy-based treatment? And additionally, has the role of religion or belief system been explored as a preventive measures or in shaping interventions as where do they fit in fostering individual and structural change? So, I mean, Ruti, you can talk to that question. And I guess this also can be addressed by any of the other speakers, especially Adila and Leanne. You talked about the proximity of the outlets to schools and religious places. So, Ruti, over to you.
Sure. Thanks for the question. I have to say the first part in terms of sort of herbalism or plant-based solutions, I can't speak a lot to it. I will say that in general, pharmacological solutions did not come up very often as something that is used particularly in low and middle income countries. I think it's something that's being explored. I'd be curious to hear more about kind of experiences of others. I will say in terms of the role of religion and belief systems, this is a really important thing that was, it's both in the literature, it was also flagged by some of the experts that we interviewed around, you know, what works to reduce alcohol use is the important role that people's faith can play in both shaping their kind of drinking behaviors and norms around drinking, right? So in both in specific religions, but also within particular faith communities, drinking may be less common or more frowned upon. So there's sort of a normative aspect of it, but there's also, especially within the context of mutual support programs like Alcoholics Anonymous, there's often a kind of a link to a higher power or something like that. And one of the experts we spoke with said that tends to resonate with people coming from, you know, people from faith communities. So if anyone else would like to add to that, but that's sort of what we heard in our review.
Thanks so much, Ruti. Anyone from the speakers to add to that?
I mean, I guess that from our perspective, that there's a role for all stakeholders in our communities to be involved in prevention. So the faith sector in South Africa, given that we have our population are quite religious, it's definitely a sector that we need to engage. But at the same time, we need to acknowledge that the faith sector would come to the conversation from a very moral-based value system, which is not necessarily where we are coming from. For us, it's about public health and it's about social justice. So as long as we acknowledge that we come to the issue with the same concern, wanting the same results, but with a different value interest, we would be able to find some common ways in how to tackle this. So definitely the faith sector has got a role in addressing and supporting prevention work.
Absolutely. Thanks, Adila, for the ad. And I wonder if someone, I guess it's from Namibia, who said alcohol is prohibited in their country on a Sunday. I wonder if it has to do with that action taking of, if it has to do with religion or anything. So whoever wrote that in the chat, please share more if you have any insights from what you've done in your country. So thank you for the ad. I saw Ingrid coming up on camera. Did you want to add something, Ingrid, or we move on to the next question?
And that's fine to move on.
Great. So the next question that we got, it could be, you know, anyone could take it. it's about the balance that we want to see. So the question says, how do we work in a climate where the balance of economic gains for alcohol sales outweighs the harmful impact of alcohol misuse? I know, Ruti, in your sharing, you talked about the alcohol industry, and so did Lian and Adila. So if you could take turns to address this question. How do we work in a climate where the balance of economic gain for alcohol sales outweighs the harmful impact of alcohol misuse?
If I can have a go and somebody wants to add. I mean, I think that the first thing we need to accept is that everybody in our community has an interest in its well-being. That's the first view that we take. And that people that are trading in alcohol are doing it for economic gain because there are no other options available sometimes for them in terms of generating income. But that they, at the heart, they would want their communities to be safer places. And so there are people that are involved in the economic value chain around sale of alcohol that lives in communities. And then there are your upstream people. I'm going to talk to the upstream people. Currently, the alcohol industry in South Africa generates about 4 to 6% of our GDP. But collectively, our governments spend between 10 and 12% of our GDP on alcohol-related harm. So I think one of the first things is that we need to start talking about exactly what is this economic gain that we are referring to. Is it a gain, or is it that we are subsidizing the profit of a harmful product and an industry? And if we can get that dialogue going in our communities, I think that we will get more buy-in to a better and more stricter regulation of alcohol. We are not by any means saying that alcohol shouldn't be sold or traded in or distributed, but we are saying it shouldn't be marketed. It shouldn't be normalized within our societies, because marketing, one, glamorizes its consumption, but also it presents a picture that it's normal for everybody to drink. But early on, I had said that alcohol in South Africa is only consumed by about 31% of our population. So if we got alcohol marketing to not be as pervasive as it is at the moment, and we would say it should be banned to the point of sale, we would reduce the kind of pressures that are on people to consume alcohol as one way of intervening. But I think that the question, and thank you for the question, it's a very tricky thing, that people that live in communities, it's their livelihood. And we need to find a way to engage them as community members and not necessarily as traders, because they live there, they've got children that grow up there, and they've got the same concerns as all other community members. If we found that angle to engage people, I think we would be able to get to a point where we can find a win-win, where potentially we could talk about having an economic zone within a residential community, so that where trade happens is not where people live, but there's a certain section within that community where all traders move to. We could engage them around trading hours, where we could come to an agreement with traders within community that they won't trade before 2 o'clock in the afternoon, so that children that go to school in the morning and have to leave, go back home in the afternoon, they are not as exposed to alcohol trade and consumption. So I think that there are ways in which we can engage traders within communities. But with regards to the alcohol industry, the producers, the distributors, the marketers, I think that the WHO 3 best buys around reducing availability, restricting marketing, and looking at pricing measures are key ways to begin to address alcohol-related harm.
Thank you so much, Adila, for your reflections, really. And I guess you also linking this to the advocacy work that SAPA has done around alcohol and violence. And if we get a few minutes, I'll move on to someone else. But if you get a few minutes toward the end, I'd like to hear more what have been the biggest challenges and any big win that you can be proud of today in the advocacy work that you're doing with SAPA. So I wanted to take the advantage of being the moderator to ask a question to Ingrid. So Ingrid, you've written and you've spoken very powerfully about listening to women's voices and experiences. What does this mean for violence prevention practitioners, us and many others may be here on the call? What should we be doing or thinking about?
Yeah. I mean, I think we've highlighted that this topic has historically been like a very contested and uncomfortable one, particularly for the violence prevention field, for the reasons that Ruti discussed earlier. And I think what has been the implication there has been that we haven't listened to women. So, and I mentioned the kind of gaslighting. It's almost like women have been kind of talked out of, what they're saying in terms of their experience of the link between when their partner drinks and their experience of violence. So I think that's the starting point. I mean, it's a fundamental from a support role to listen to women. So if they're telling you that they feel afraid when their partner drinks, if they're telling you that their primary concern is because how his drinking affects her, how she feels afraid, how the children feels afraid. We can't get into a debate about, does alcohol cause violence or not? That's not serving the needs of that woman who's presenting to you. So even some of the women that I interviewed for my own research, who in fact were working within the sector, they said that alcohol just wasn't talked about. So I think we just have to, no matter how uncomfortable we feel about talking about alcohol, we absolutely have to start, push those aside and to actually listen to women. And I think that's the starting point. And then, we really need to think about, well, what is in place to support women around their primary concern, which for them is around getting him to stop drinking, getting him to into some form of treatment, because often their partners are not treatment seeking. One of the things that could be improved is the kind of ecosystem of support, which doesn't necessarily sit within, say, the alcohol treatment space, nor the violence prevention space. For example, general practitioners. Women talked about going to their general practitioner and the GP didn't even know where to start. So educating general practitioners about when someone talks about their partner's heavy drinking, even just being, understanding some of those links can mean that they can have a bit of informed conversation to ask, is she safe? And then just have the appropriate referrals there and some kind of support to help her along that way to get her partner to stop drinking. And just one last thing is also from the alcohol treatment side of things. Yes, focusing on the drinker is important, but absolutely engaging with the partner and ensuring that those kind of supports are also about her safety. So that's what I think is some important starting points anyway.
Thanks so much, Ingrid. This is really important to see how we're getting towards, thinking about what do we do, what are the starting points, what are our advocacy points of departure, what have we done in this on this topic. And I particularly like the fact that you say, yes, we need to do something, we need to push. I mean, it's a matter of, we are activists and we really need to do something. So I I am cautious of the time, and I don't want to take my privilege of being the moderator. If there is anyone in the audience who's got any burning question before we take one last question from the chat and then close the webinar, please feel free to let us know. Otherwise, I'll go back to our speakers, and probably I really want to know about the advocacy work, because we know we've been talking about what can be the barrier, who can be the barrier, who can play the gatekeeper's role. And I know some work have been done in many countries, but here we are privileged to have you, Adila, and Leanne from South Africa. I just wanted to hear about what have been your biggest, the biggest challenges in the work that you've been doing, the advocacy work, and also to be encouraged, what are the wins so far? What can you say you are happy with, so we can get encouraged, because we could really relate with what you found in the study, and we know you've been doing advocacy around that.
Thanks, Rita.
So I'll start.
Oh, sorry. I wanted to lead, because Adila, I want to give you the last word, given that much of your life's work is dedicated to advocacy. I think in relation to particularly the project we presented today, as taking that first step and actually engaging and with advocates working in the area and collaborating with advocates to address these issues is, for me, the first conscious effort that we can make as people working in this field to prevent both gender-based violence and alcohol use. And our partnership with SAPA, for example, really provided a wonderful opportunity for us to say, how do we apply an evidence-based approach to the advocacy work that is already being done, in a way that the evidence will inform the advocacy efforts and the prevention efforts that are happening at community level. But also, it enabled an opportunity for us to be able to really work from the bottom up and say, what are communities themselves saying about how these issues of alcohol availability and gender-based violence, for example, are affecting them? And to really give them the voice that Ingrid was talking about, giving to women, which is equally important, giving voice to communities, because our laws do state that communities have an opportunity and should have an opportunity to weigh in around decision-making around the alcohol laws. So I think for me, that was the biggest joy of working with an advocacy organization, and then really getting down in the weeds, and really being able to work with people from communities, as Adila spoke about, and learning together, learning about community dynamics, but also sharing basic research methods in our training of locally identified field workers. Those are some of the practical things that I think can happen. And it's not all roses. It takes patience, but it takes a commitment from both the research side as well as advocacy side, as well as from the communities, in a joint commitment towards working together. And I'll hand over to Adila now. Thanks.
Sure. Thanks. I think that Leanne's point around partnerships is an opportunity to co-create. And Ruti had mentioned the issue around a gender-informed alcohol regulation. So what is it that we as activists, as practitioners, as researchers, how can we collaborate and co-create to introduce this notion of a gender-informed alcohol regulatory framework? I think that that's something that we could work on. And Ingrid's point that it's a package. It's not one or the other. It's how do we look at a package of interventions that looks at individual, whether they're men or women, at families, at communities, but also look at what are some of the structural issues that needs to be addressed so that we can create a supportive environment for individual and social change. I think that is important. In terms of some of our challenges, the biggest challenge is political will. The lack of political will to look at alcohol regulation as a means to intervene within communities to create a different environment. Because the more alcohol available in communities, the more alcohol will be consumed, and therefore the harm will be there. We need the political will to better regulate, to take alcohol outside or on the side of communities so that children, women, and men are not exposed every day to alcohol trade that comes with many different behaviors that most of us don't like. So I think the issue around lack of political will is the biggest issue. And how do we get our governments to see alcohol as a developmental obstacle? We're all talking about the SDGs, SDG 1 to 17, but we know that alcohol actually impacts on 14 of those SDGs. And unless we address alcohol, we're not going to achieve the SDGs that we've all signed up for. In terms of what's been an achievement, our government tried to introduce a education amendment bill, which was called BALA, where they introduced the notion, an idea that schools should get liquor licenses so they could sell alcohol to raise money as fundraisers. And I can see people shaking their heads.
You muted, Adila.
Sorry. The proposal was introduced in December 2021. It took us about 18 months of lobbying, of working with other people, mobilizing, informing people about this. And the education department was forced to withdraw this proposal as part of this education amendment bill. So what we learned from that is that, one, we need to be vigilant around the kind of regulations government try to introduce and shift the responsibility for things that they should be taking care of to communities. The second is that we just have to continue and continue and continue. That it's not something that we win within a day, a week. Sometimes it takes years. But with joint effort and with perseverance and with bringing more people on board, we are able to win. And I think that's for us the biggest lesson that we've learned, that it's possible to win. It's just how we strategize to get there and who we bring along with us to be a joint voice rather than being just one voice.
Great, wonderful. Like I just typed in the chat, great advice, Adila, and really encouraging. So there we can win. We just need to keep going and keep pushing, like Ingrid said, and there is evidence that we can do more. So I know we run out of time, and I wanted to really, really thank you. And thanks, first of all, our speakers for such a rich sharing. If we can, we could all be there to clap for you for the rich information that you've shared. And again, I have to recognize that this wasn't enough time for us to go and discuss deeper this question, but I'm so glad that we are having this conversation, and I hope you will get opportunities to continue interacting on that. So we at the collaborative want to thank you all. Dear participants, our speakers, we have a slide that will show you how we can stay connected if they can display it. This is such yeah, thank you. I'm noticing that people are saying that it was a rich information session of information, but I also want to say that a lot of resources have been shared in the chat. We'll share the recording, and you can stay connected with us. Hopefully you can find more resources on our website, as you can see on the screen, and you can also subscribe to receive our digest so you can keep posted on what is more is coming. Please, if you want to stay connected with us, you can follow us on Twitter, you can like us on Facebook, and stay engaged with us on LinkedIn. So on behalf of all my colleagues behind the scene, our tech team and others, I want to thank each and everyone for your participation today. Thank you so much. And until we meet next time for another webinar, I'll say goodbye. Thank you.
Bye. Thank you.
Thank you.
Bye. Thank you so much.
Thanks, everyone. Bye-bye.